welcome back. And we are moving into our final segment for today. I kind of feel like this is like the first segment again where you want to cover your ears and say no. But it's important. Taking care of your health for 2018. In case you didn't get it started right in 2017, we have with us Dr. Fernando Cuellar, who's an internist at the Belize Medical Associates. Good morning and welcome.
Morning, Marlene. Morning, Shannon. Thanks for the invite. Thanks for having me so early in the year.
Well, you know, it is the time of year where people are setting goals for themselves, and top on that list are some health goals as well. Before we move into some of the priority areas that I know you wanted to discuss, I wanted to start off with looking at a checkup. And especially for persons who are signing up for boot camp, for gym, for multiple training programs, how important is it that they go to the doctor first?
Extremely important, Marlene, extremely important. And it won't be just for this particular reason that you want to make sure everything is all right before you start a program. Yeah. It's just part of your everyday life. You need to have a checkup at least once a year. Everybody, from 0 to 100. Okay, so the babies will go for their the baby checkups, the teenagers, the young adults, the older adults, the elderly people. You do need to have that once a year at least, at the very least, to go into your clinic, to your healthcare provider to get a checkup.
And what does that entail?
It entails a discussion. You'll have to have a discussion with the caregiver, tell them what your symptoms are if you have any. And if you feel good, then you will say you feel good, you're just coming for a checkup. The healthcare provider would have a more direct line of questioning, specifically from head to toe, if you have headaches, if you have numbness in your feet, if your weight loss, if chest pains, if the bowels are okay, if the urination is good, if your skin okay, your nails, your hair, okay, your energy, okay, all of these things have to go. You have to go through them to be part of a full checkup. That's the first part, that discussion in the office or in the clinic. The other one is doing a set of basic tests. There are a basic panel of tests. It varies depending on the age group, the gender, okay, but a blood, urine test, stool test, and then if necessary, you go on to more detailed investigation, depending on, you have, for example, men at age 40 and above would have a PSA for check their prostate, colonoscopy, a discussion about colonoscopy at age 50, both male and female. Of course, in female, gender specific would be the breast examination, the mammograms, the pap smear. So you do need to have that checkup.
Okay. And once a year is okay?
Once a year is minimum.
Okay.
Yeah.
It's minimum.
Yeah.
People would need twice a year, 3 times, depending on if they have diabetes, if they have hypertension, and that kind of thing.
Now, tell us some of the examples as to how getting a checkup can drastically improve your quality of life.
Diabetes, for example, I think that's a classic. People who, unfortunately, or high blood pressure. People don't know that because sometimes these conditions come without symptoms. I feel good, nothing wrong with me. I don't see any changes. But when they do the testing, when they do their blood pressure checks, they realize that their blood pressure is a bit high. And unfortunately, these things creep up on you. It's not something, many times it doesn't give you immediate complications, it's long term. So by the time you know it, your kidney don't start to misbehave, your eyes not to work properly, your heart start getting enlarged, and by then it's a little bit too late, no? Because unfortunately, a lot of things are not reversible.
Yeah.
Okay.
Yeah. And cardiovascular disease too, I would imagine. Heart problems.
Heart, strokes.
Yeah.
Okay, those are. And you know, Belize, we have this saying, unfortunately, that something has to kill you. I mean, I still hear it.
Yeah.
Less, but I still hear it. That, something will have to kill me at some point. But we would all want to go away in our sleep and
peacefully.
We wake up dead, so to speak. But that's not the case. No, you suffer.
Yeah.
Your family suffers. Yeah. And I think that's key, that most people don't realize, that it's not only them, but their family, their children, their spouses. They suffer financially, socially, okay?
Yeah.
And that's really being selfish if you don't take care of yourself and burden your family.
That is so true, because we don't know, if I am to think, we don't know that many people who die instantaneously. Sometimes it's a stroke or extended stay in the hospital.
Kidney failure, and the famous dialysis and how what burden it places on people.
Okay. So that checkup can help you to detect it early.
Definitely.
Okay.
And so 2018, how do we get a good grip on our health for 2018?
Well, since I got the call yesterday to come in, I was asking myself, why 2018? This should be a year-long thing, no?
I mean, but
this whole thing about New Year's resolution, and it's a daily challenge to try to live as healthy as possible, no? It's a challenge, it's difficult, especially in the type of environment we're in. We are working and we have so much to do, and so, but it comes back down to the two basics. Try to eat healthy and exercise, okay? And you don't need to go to any fancy gym or anything. You could do walking in the morning, jogging, swimming, anything that all you need one. You need one good pair of sneakers, for example. You just need to walk, okay? We have vehicles that we use for everything. Why don't we walk to the store or walk downtown or come back walking and plan for it, no? Eating healthy is a whole lot of discussion, but I think most people realize what is basically healthy and what is not so healthy, okay? Our fruits, our vegetables, right? You could cheat now and again. You could have your day of the week to cheat, to eat your favorite food, but overall, it's that conscientiousness of eating healthy every day, okay?
Now, that's a hard one for people, and I find, especially this time of year, and I know not everybody signs up to the resolutions, but if somebody is making an effort to get healthier, and they don't have the proper advice, they may go on drastic diets. They may eat lettuce for, I don't know, a month.
Or just drink my juice.
They may cut out all carbs or cut out all fat or cut out, some people do only protein. There's so many different, they go vegan. What are the risks when you try to do these drastic type of diets?
There are huge risks, Marlene. You have to do it scaled down. You have to have some discussion with somebody that has a little bit better idea of the food groups of what to do. I would never encourage anybody to go from 100 to 0 and just go on lettuce and all of these
cabbage
things.
soup.
Just a common sense approach. Reduce portions, for example. Okay, instead of eating the big plate of rice and beans, cut it by half. Okay, try to not use fat and fried and so much. Try to no grill and bake and that kind of thing. No, try to stick to your chicken and fish. Try to see how we can get more fish in our diet, more fruits, more vegetables. There are a lot of labels to diets. As a matter of fact, I always tell my clients in the office that I particularly don't like to use that word diet. Okay, to me that's one wrong word to use. You're not going on a diet. You're going to start to eat healthy. So you try to get into the concept of eating healthier rather than going on some South Beach diet or some other fancy
Juicing diet, smoothie diet.
And then
or starving themselves.
You took it out of my mouth, but that was the other thing that I want to cut out one meal. And no, you don't need to cut out meals. Just reduce the portions. No? You need the meals for the day. Breakfast, for example, most of us tend to eat on the way, grab something to eat, but you should take a little bit more time to try to get a more balanced first meal of the day.
I definitely should.
So we talked about eating healthy, and I like what you said, because some people feel like they'll never be able to have rice again once you say eating healthy, but it's just the portion size that makes
very
the
much
difference.
important.
And exercise. How much exercise? What type of exercise?
How much? That's a very frequent question. I usually tell my patients that at least 3 times a week. You don't need to be exercising every day. Okay, 3 times a week minimum, of course, and at least 30 minutes each time. So the 3 times a week, 30 minutes every time. Do the walk, go around the block, go walk. Walking is a very basic but very helpful thing. If you want to get a bit more fancy, then you can bicycle like me, okay, or or weights, with resistance
go
training.
to the gym, use a treadmill.
Okay, but walking should fit any good exercise plan.
So 30 minutes a day for three times a week. That's basic for heart health.
Exactly.
But if you want to lose weight, you have to put in a bit more.
Yeah.
Yeah. Okay.
But even for heart health, isn't it important to sometimes do like high intensity interval training, where maybe you get your heart rate up a little bit?
Yeah. That's the final thing. But at least I want to leave here today with a basic plan. Where the average housewife, the man on the street, anybody can think about doing that.
Yeah.
Okay.
In fact, the biggest conversation globally when it comes to healthy living is talking about how sitting is killing us. That sitting is the new smoking.
Yeah.
Sedentary lifestyle is a lot more common than we care to acknowledge. Why is this?
With progress bring problems, I guess. I guess we're becoming more of a sophisticated society where we have 70-inch TV screens, curve, we have remotes, that are smart. You talk to them and you have to know. So you basically sit, the kids, for example, that's a huge thing, the kids with their games. I see them, my kids stay up till 1, 2 in the morning playing PS4s and Xboxes. They're not as active as before, leading to childhood obesity, which of course lead to adult obesity, which is a big bad word, obesity. It's a disease. It's not a, I don't know how you look. No, it's causing problems from, it makes heart disease more common, more strokes. It also now is involved in the cancers, for example. So obesity, and I'm glad that we're mentioning it, no?
It's a classified condition now.
It's exactly.
Chronic, non-communicable
disease.
disease.
NCD, no?
Yeah.
So the big fat baby where we used to think was healthy, not so healthy again. You look around every day and we have a lot of obesity in Belize.
Of course.
Okay.
Of course.
Fluffy girls, fluffy boys. I know it's
but it's become so taboo, and I think that's the worrisome part. And I always use the example for an obese person to start a healthier lifestyle. It's challenging, you know, and I think that's where we can appreciate where you say 3 times a day for 30 minutes. If you are morbidly obese, or overweight, then start with that, and you will eventually be able to put in more.
Exactly.
So we talked about getting in that exercise. What are some of the other things that we have been neglecting as Belizeans?
We always have to touch on the reduction in alcohol use. That's a big thing. Okay, smoking. I'm not sure where we are with that. Sometimes I get mixed signals, and sometimes thinking that we are smoking less. But at other times you look around and you say, maybe not indeed. Alcohol, smoking. One of the things I mentioned was this whole thing with the motor vehicle accidents, with trauma, of it being a public health. It's really putting a burden on our healthcare system with all of these accidents and trauma and taking care of patients with these severe injuries, the amount of resources that you use when you take care of them. They're taking away from putting the resources to other places, no? Okay. Blood supply, for example, another thing, and it works both ways as a community, be more involved in the whole thing with blood. And of course our authorities have to do a better job in ensuring that our blood supply is more efficient. No? Okay.
Yeah, donate as much as you can.
The public health thing, and hopefully we can be more stringent of drunken drivers and breath analyzing and all of the thing. And I mean, we don't have super highways. I'm not sure why we're not doing a better job in controlling drunk driving. No.
Yeah, and you see these accidents quite often. From motorcycles to the different
they're
vehicles.
happening a lot within city limits nowadays. So why are we in so much of a rush to go everywhere? No? We use seat belts.
Do seat belts make an impact?
Of course.
I know it seems like a silly question, but I feel like I'm still arguing this point with people all the time.
It does. I mean, you can get finicky and say how seat belts themselves can produce injuries. That's sure.
So you get a bruise across your chest, but it's better than your head through the windshield.
Correct.
Yeah.
So statistics have proven in other places that seat belts have made a huge reduction in mortality and that.
And children in car seats.
Oh my. The amount of
Tell
times
us about
you see kids on the back of motorcycles.
And the back seats and the front seats and being on the driver's lap. and that we have to do better as a group. Don't leave it just on the authorities, or call it out to your friend. If you see somebody in the next car with a baby at the front, you might get cussed, but please, Miss or Mister, put your baby in the back. No man, it help. You never know when something will happen.
Yeah.
Okay.
Yeah.
You have to be your brother's keeper, so to speak.
How about this one? This is one of my personal resolutions. Getting sufficient sleep. How important is sleep?
I wonder if I had the correct person to answer.
I know. Well, I was gonna say I know you're, but I read books about it. I know how important it is, as I'm sure you do.
It's very important. We need that good 6-8 hours of sleep.
6 to 8.
6 to 8. You got this discussion back and forth depending on your age and so forth. But I think generally, 6 to 8 hours of sleep are a good resting time so that you can stay healthy, because it will affect heart health. It will affect everything else.
Yeah, sleep affects everything. From your memory to your weight to your heart to
libido, to everything.
To even your lipids levels, everything. But
you're getting personal.
6 hours. No, and I don't have a problem saying things. I think, when we spoke about non-communicable diseases, this is a global priority for WHO as well, talking about the cancers, obesity, talking about diabetes, hypertension, and cardiovascular diseases. But we also didn't talk about cholesterol levels.
Huge problem. We definitely, again, have to go back to the two basics: eat healthy and exercise. Unfortunate at times, and I say unfortunate because we do need medication to help control these things. And why is it important? Because cholesterol, for example, plays a vital role in the development of heart disease. No? Heart disease comes about because your arteries, the little vessels get clogged up, and they get clogged up with cholesterol plaques. Having high cholesterol continuously will cause these plaques to grow, so it obstructs, it hambugs the movement of blood through your arteries, and so that's why you end up with a heart attack and stroke. So by lowering your cholesterol, you do a service to yourself so as to avoid these things happening.
Now, what are some of the foods that you should avoid if you're trying to maintain your right cholesterol levels?
Well, you have to reduce the fatty food, of course. You can eat a piece of pork that is lean, cut off the fat. Okay, and when I talk broad thing, we're not into the saturated fats and all
That's
these
fine.
things. So
we want people to understand.
You try to gravitate to more chicken and fish. Try to fry less. If you're going to fry, use things like maybe olive oil or canola. Again, very big debate about our favorite coconut oil. I just tell people, listen, just reduce it. Use it for your Sunday flavor. Everybody like that good Caribbean coconut flavor. And it's nice. I mean, we grew up on coconut. Then you hear this whole story about we grew up on this and we grew up, and we did. Okay?
I hear it all the time.
But then you eat your coconut oil every day, but you walk downtown. You never got a car.
More active.
Husband never got a car, wife never got a car, you got 3-4 cars.
Walk everywhere.
Walk every day. Okay, you're gonna
and the jobs were more manual as well.
So this whole thing has changed, but so that's why we are seeing
because like even
things.
high cholesterol and blood pressure and those things, when I was younger, I thought that only old people were affected by that, and then now I'm realizing that it has a lot to do with the lifestyle and the food we eat now, and a lot of younger people are being affected by those sicknesses.
And genetics
plays a role too, which is important that you should take time out to know your family history. Where grandpa did from, where me happened to granny or this auntie or mommy or daddy. Unfortunately, at times you still ask that question. I don't know.
We used to just hear old age. And so you really can't tell if it was some form of cancer, which would mean you'd be more predisposed to developing cancer as well. So that's where the annual checkup comes in important.
Basic things too, like basic hygiene needs to be mentioned. Always to wash your hands. Soap and water is always the best. Okay, these fancy sanitizers is better than nothing, but they're still not as effective as soap and water. At work, at home, if you have only flu, only cold, it isn't a bad idea to stay home a day or two so as to avoid the spread. Okay, in the office and that kind of thing.
So you mean when you get 2 days off from your doctor because of a flu, you should actually stay home
Yes.
because you don't want to get everybody else sick.
Yeah. And by you staying home, you're resting, you're recovering faster. Okay.
All right, one thing, if you could have all the lesions change from this point forward for a healthier life, what would it be?
Eat healthier.
Eat healthier, okay.
So no more lychee.
Well, we don't want to single out lychee, but you could have your lychee once a month. Again, you could treat yourself to
Yeah.
only now and again, no, but you can't have lychee three
Every
times,
day, yeah.
4 times a week. no?
Yeah,
Okay.
okay. All right, we have our challenge.
Yeah. And it's a year-round challenge, and it's an effort for the whole family. It's not just mommy, daddy.
Yeah.
The kids also are playing a big role in signaling out, no, this is a good food group.
Yeah.
We need to do that. No?
Yeah. All right. Well, thank you so much for this information. We appreciate it. And hopefully people will take that one bit of advice that we eat healthier
Yeah.
for 2018. All right. We're going to go ahead and take our final break now. And when we come back, we'll have our wrap-up. So stay tuned.